What does the P wave in an ECG represent? Option 1. Atrial depolarization. Option 2. Ventricular depolarization. Option 3. Atrial repolarization. Option 4. Ventricular repolarization. The answer is option 1. Atrial depolarization. What does the QRS complex indicate in an ECG? Option 1. Atrial depolarization. Option 2. Ventricular depolarization. Option 3. Atrial repolarization. Option 4. Ventricular repolarization. The answer is option 2. Ventricular depolarization. What is the normal duration of a QRS complex in an ECG? Option 1. 0.04 to 0.1 seconds. Option 2. 0.12 to 0.2 seconds. Option 3. 0.3 to 0.4 seconds. Option 4. 0.5 to 0.6 seconds. The answer is option 1. 0.04 to 0.1 seconds. What does the T wave in an ECG represent? Option 1. Atrial depolarization. Option 2. Ventricular depolarization. Option 3. Atrial repolarization. Option 4. Ventricular repolarization. The answer is option 4. Ventricular repolarization. What is the typical heart rate range in a normal sinus rhythm? Option 1. 40 to 60 bpm. Option 2. 60 to 100 bpm. Option 3. 100 to 140 bpm. Option 4. 140 to 180 bpm. The answer is option 2.60 to 100 bpm. Which part of the ECG cycle corresponds to atrial contraction? Option 1. P wave. Option 2. QRS complex. Option 3. T wave. Option 4. Saint segment. The answer is option 1. P wave. What is the purpose of the PR interval? Option 1. Measure ventricular repolarization. Option 2. Reflect atrial and AV nodal conduction. Option 3. Measure atrial repolarization. Option 4. Measure ventricular depolarization. The answer is option 2. Reflect atrial and AV nodal conduction. What does an elevated ST segment indicate? Option 1. Atrial fibrillation. Option 2. Myocardial infarction. Option 3. Bundle branch block. Option 4. Premature ventricular contraction. The answer is option 2. Myocardial infarction. What does a prolonged QT interval indicate? Option 1. Bradycardia. Option 2. Increased risk of arrhythmias. Option 3. Atrial fibrillation. Option 4. Hypertension. The answer is option 2. Increased risk of arrhythmias. What is a common feature of atrial fibrillation on an ECG? Option 1. Absence of P waves. Option 2. Prolonged PR interval. Option 3. Wide QRS complex. Option 4. Elevated ST segment. The answer is option 1, absence of P waves. What does a flat T wave suggest in an ECG? Option 1, hyperkalemia. Option 2, hyperkalemia. Option 3, myocardial infarction. Option 4, ventricular tachycardia. The answer is option 2, hyperkalemia. Which condition is indicated by a sawtooth pattern in an ECG? Option 1, atrial flutter. Option 2, ventricular tachycardia. Option 3, first degree AV block. Option 4, saint elevation. The answer is option 1, atrial flutter. What is the normal duration of a PR interval? Option 1, 0.04 to 0.1 seconds. Option 2, 0.12 to 0.2 seconds. Option 3, 0.3 to 0.4 seconds. Option 4, 0.5 to 0.6 seconds. The answer is option 2, 0.12 to 0.2 seconds. What does a wide QRS complex indicate? Option 1, ventricular conduction delay. Option 2, normal conduction. Option 3, atrial depolarization. Option 4, AV nodal delay. The answer is option 1, ventricular conduction delay. What does an inverted T wave indicate? Option 1, normal finding. Option 2, myocardial ischemia. Option 3, ventricular depolarization. Option 4, atrial depolarization. The answer is option 2, myocardial ischemia. Which arrhythmia is characterized by chaotic, irregular QRS patterns? Option 1, atrial flutter. Option 2, ventricular fibrillation. Option 3, first degree AV block. Option 4, bundle branch block. The answer is option 2, ventricular fibrillation. What is the significance of the ST segment? Option 1, measures atrial contraction. Option 2, represents the isoelectric period of ventricles. Option 3, reflects atrial depolarization. Option 4, indicates ventricular filling. The answer is option 2, represents the isoelectric period of ventricles. What is a common feature of ventricular tachycardia on an ECG? Option 1, narrow QRS complex. Option 2, wide QRS complex. Option 3, regular P waves. Option 4, normal T waves. The answer is option 2, wide QRS complex. Which interval measures the time from ventricular depolarization to repolarization? Option 1, PR interval. Option 2, QT interval. Option 3, RR interval. Option 4, saint interval. The answer is option 2, QT interval. What does the RR interval represent? Option 1, time between atrial contractions. Option 2, time between consecutive R waves. Option 3, time of ventricular repolarization. Option 4, time of atrial repolarization. The answer is option 2, time between consecutive R waves, which is a common sign of first-degree AV block. Option 1, shortened PR interval. Option 2, prolonged PR interval. Option 3, absent QRS complex. Option 4, inverted T wave. The answer is option 2, prolonged PR interval, which is a defining feature of second-degree AV block. Type 1, Wenke-Bach. Option 1, constant PR interval. Option 2, progressively lengthening PR interval. Option 3, absent P waves. Option 4, wide QRS complex. The answer is option 2, progressively lengthening PR interval, which condition is characterized by a completely disorganized electrical activity in the ventricles. Option 1, atrial flutter. Option 2, ventricular fibrillation. Option 3, bundle branch block. Option 4, Saint depression. The answer is option 2, ventricular fibrillation. What does the U wave represent in some ECGs? Option 1, atrial repolarization. Option 2, delayed ventricular repolarization. Option 3, ventricular depolarization. Option 4, atrial depolarization. The answer is option 2, delayed ventricular repolarization. What condition does a shortened QT interval suggest? Option 1, hypercalcemia. Option 2, hypocalcemia. Option 3, hyponatremia. Option 4, hyperkalemia. The answer is option 1, hypercalcemia. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. Which congenital heart defect is characterized by an opening between the atria? Option 1, atrial septal defect. Option 2, ventricular septal defect. Option 3, patent ductus arteriosus. Option 4, tetralogy of Fallot. The answer is option 1, atrial septal defect. What is the main characteristic of a ventricular septal defect? Option 1, opening between the ventricles. Option 2, narrowing of the aorta. Option 3, incomplete closure of the ductus arteriosus. Option 4, malformation of the heart valves. The answer is option 1, opening between the ventricles. Which congenital heart defect is commonly referred to as a hole in the heart? Option 1, atrial septal defect. Option 2, coarctation of the aorta. Option 3, pulmonary stenosis. Option 4, patent ductus arteriosus. The answer is option 1, atrial septal defect. Which condition involves the failure of the ductus arteriosus to close after birth? Option 1, patent ductus arteriosus. Option 2, tetralogy of Fallot. Option 3, transposition of the great arteries. Option 4, hypoplastic left heart syndrome. The answer is option 1, patent ductus arteriosus. Which congenital defect is part of tetralogy of Fallot? Option 1, pulmonary stenosis. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent foramen ova. The answer is option 1, pulmonary stenosis. Which is the most common congenital heart defect? Option 1, ventricular septal defect. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent ductus arteriosus. The answer is option 1, ventricular septal defect. Which diagnostic tool is most commonly used to identify congenital heart defects? Option 1, echocardiography. Option 2, MRI. Option 3, CT scan. Option 4, chest X-ray. The answer is option 1, echocardiography. What does coarctation of the aorta involve? Option 1, narrowing of the aorta. Option 2, opening between the atria. Option 3, incomplete valve formation. Option 4, failure of the ductus arteriosus to close. The answer is option 1, narrowing of the aorta. Which condition is characterized by the transposition of the great arteries? Option 1, switching of the pulmonary and systemic circulation. Option 2, narrowing of the aorta. Option 3, incomplete valve closure. Option 4, opening between the ventricles. The answer is option 1, switching of the pulmonary and systemic circulation. What is the main goal of treating congenital heart defects? Option 1, restore normal blood flow. Option 2, reduce blood pressure. Option 3, increase oxygen levels. Option 4, prevent arrhythmias. The answer is option 1, restore normal blood flow. Which congenital heart defect involves underdevelopment of the left side of the heart? Option 1, hypoplastic left heart syndrome. Option 2, ventricular septal defect. Option 3, coarctation of the aorta. Option 4, pulmonary stenosis. The answer is option 1, hypoplastic left heart syndrome. Which surgical procedure is often performed for tetralogy of Fallot? Option 1, Blalock-Taussig shunt. Option 2, Fontan procedure. Option 3, Norwood procedure. Option 4, Ross procedure. The answer is option 1, Blalock-Taussig shunt. Which congenital defect is associated with cyanosis due to oxygen-poor blood entering circulation? Option 1, tetralogy of Fallot. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent ductus arteriosus. The answer is option 1, tetralogy of Fallot. Which medication is used to keep the ductus arteriosus open in certain congenital heart defects? Option 1, prostaglandin E1. Option 2, aspirin. Option 3, beta blockers. Option 4, ACE inhibitors. The answer is option 1, prostaglandin E1. Which is a key feature of an atrioventricular septal defect? Option 1, combination of atrial and ventricular defects. Option 2, narrowing of the aorta. Option 3, failure of valve formation. Option 4, inverted blood flow. The answer is option 1, combination of atrial and ventricular defects. Which is the primary purpose of a Fontan procedure? Option 1, direct blood flow to the pulmonary arteries. Option 2, close a ventricular septal defect. Option 3, repair coarctation of the aorta. Option 4, replace heart valves. The answer is option 1, direct blood flow to the pulmonary arteries. Which is a potential complication of untreated congenital heart defects? Option 1, heart failure. Option 2, liver damage. Option 3, kidney failure. Option 4, stroke. The answer is option 1, heart failure. Which imaging technique is most effective for visualizing heart anatomy in congenital defects? Option 1, MRI. Option 2, echocardiography. Option 3, CT scan. Option 4, chest X-ray. The answer is option 2, echocardiography. Which congenital defect is part of Eisenmenger syndrome? Option 1, ventricular septal defect. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent ductus arteriosus. The answer is option 1, ventricular septal defect. Which is the function of a cardiac catheterization in congenital heart disease diagnosis? Option 1, assess pressure and oxygen levels. Option 2, close the septal defect. Option 3, replace valves. Option 4, administer medication. The answer is option 1, assess pressure and oxygen levels. What does cyanotic heart defect mean? Option 1, reduced oxygenation of blood. Option 2, excessive blood flow to the lungs. Option 3, increased heart size. Option 4, narrowing of blood vessels. The answer is option 1, reduced oxygenation of blood. Which congenital heart defect involves the pulmonary valve? Option 1, pulmonary stenosis. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent ductus arteriosus. The answer is option 1, pulmonary stenosis. Which condition is corrected using a Rastelli procedure? Option 1, transposition of the great arteries. Option 2, coarctation of the aorta. Option 3, ventricular septal defect. Option 4, atrial septal defect. The answer is option 1, transposition of the great arteries. Which is a common symptom of congenital heart disease in infants? Option 1, poor feeding and weight gain. Option 2, high blood pressure. Option 3, frequent urination. Option 4, muscle weakness. The answer is Option 1. Poor feeding and weight gain. Which congenital defect is treated using a balloon valvuloplasty? Option 1. Pulmonary stenosis. Option 2. Ventricular septal defect. Option 3. Atrial septal defect. Option 4. Patent ductus arteriosus. The answer is Option 1. Pulmonary stenosis. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.